Good afternoon, everybody. I'm Federico Sittaro, and I work at the International Committee of the Red Cross. Dr. Mirko Winkler from the Swiss Tropical and Public Health Institute will be available for the Q&A. So I will use my presentation to tell you about the journey of the ICRC in Gaza, how we have established this collaboration between these two institutions. And above all, it's a story about WASH activities, humanitarian action, and more in general, public health engineering at city scale. The first part of the story is to define what ICRC calls urban project. We advise and support local utilities to keep an acceptable service level during armed conflict. Water production, water disinfection, wastewater networks, operation and maintenance, wastewater treatment, you name it. We have been doing a lot in Gaza in the last few years. Take this map, for example. Each dot is a facility belonging to the water sector only. It is a project that we have done, 254 in 6 years. Some, of course, are big, some, of course, are smaller. But what we have come to realize is that, honestly, 10 times more, and yet they will never be enough. The system is big, it's complicated, it's intricate. We can turn around forever. In some cases, we have been working in the same facility twice, in some cases 4, even 6 times. This is firefighting. So we started asking ourselves the following question. As a humanitarian actor, can we move away from this firefighting approach? Can we be an agent of long-lasting change while maintaining our humanitarian imperative? So if you want, this slide is the same story, but told in another language. We let the money do the talking. This is the evolution over time of our urban project. And in this case, it's not only infrastructure. And it is real implementation. Salary, for example, are not included. Of course, you can argue that this is a drop in an ocean of needs, but I would argue as well that it's not an insignificant drop. And certainly we can see some trends. After the conflict in 2014, for example, we stepped up to cover the gaps. And that is something that we believe we know how to do it. It's part of our mandate. But what happens after is that progressively the effort drifts towards keeping the system floating. And that is difficult because the focus keeps shifting over. Every time there is a new crisis, problems get chronic. We fix something and then it's the thing next to it that fails. The firefighting approach has intrinsic limitations. So we realize, in other terms again, that we had a planning problem. How to plan against the failure propagation in interconnected infrastructure systems. We called for help. We hired a bunch of consultants whose job was to elaborate an infrastructure risk assessment plan. In simple terms, we were hoping to find the bottlenecks that could give us priority interventions. Well, it turned out that nothing was simple about it, starting from the interpretation of the results. This chart, for example, is showing what functional elements, if they collapse, have the greatest cumulative impact in public health terms. Honestly, it took a while to digest this whole process, but it made us think, and we came up with new ideas. One thing that we realized, for example, is that if we wanted to deliver outcomes at water and sanitation level, we had to act on the power sector. And honestly, it's evident. The reason is simple. The fragility of the power sector cascades over the water and wastewater sector. So wastewater pumping station can't work if the power is distributed only every 8 hours. So we started implementing new types of projects. In this case, we took the sewage intermediate pumping station and we connected each of them to at least 2 transformers that are located in different distribution areas. It means that they can always be operated. Power supply for these facilities, it's not an issue anymore. This is a water production site. Once again, we doubled the feeders from the power grid, but also we added enough solar panels to operate during daytime. Furthermore, we made sure that the excess of energy produced could be injected back in the grid. So now we just finished 1 year of operation of this facility, and the volume of water distributed has increased by 54%. The number of service interruptions have reduced to an insignificant level. Water revenues have almost tripled. And as a free side product, every month enough energy to cover the needs of 35 households is injected in the grid. There is another very interesting feature for us that sadly is tested as we speak, is that this facility should be able to work in a standalone mode when the grid goes off for longer period during conflict escalation. So we really hope that right now it is delivering the needed continuity of service. So to go back to our story, honestly, we liked a lot what we were doing. And we believe that the idea of working at system level proved successful. We learned that system interconnections can be turned around to deliver results. So now we want more. We wanted to shorten the path between infrastructure provision and health impact on the general population. And we realized that we needed a piece that we couldn't find, the epidemiological link, the quantitative association between and the health of its residents. So if we have to produce this piece of evidence, how we should go about it? So we needed something that is at the same time comprehensive, but also actionable in a realistic time frame. And health impact assessments appear to match the bill. I will let Mirko provide more details, of course, during the Q&A, but in essence, the approach is similar to the more known environmental impact assessment. The focus now is on people health. So here you can find the initial objective that we set them at the very beginning of this process. And honestly, it has been a challenge to strike the right balance between a concrete practitioner focus and at the same time, the capacity to target the entire urban texture of the urban Gaza Strip. So what emerges is an intense and articulated process that goes far beyond traditional wash domains of intervention. And it was challenging because individual and team competencies had to be reshuffled. New stakeholders need to be involved. In essence, it's a big step outside the traditional comfort zone. In practice, the health impact assessment has defined a path of operational-oriented research. Each domain has been screened for further investigation. Here you see, for example, some of the analysis related to wastewater management. And for example, its possible relation with high-level nitrates in drinking water. The determinants relative to each main domain have been scored versus their known potential health outcomes. And here, with these metrics, finally, we see the materialization of the missing piece I mentioned a few slides back. The link between the function that we can contribute to deliver as infrastructure providers and the health of the population. Pushing things one step further, the analysis has identified the evidence gaps, whether we can use existing evidence to make sure that we are not reinventing the wheel, and where instead we need to mobilize to produce new information. We have now a specific list of issues that we want to focus on for the next few years. What matters to make a long-lasting change? So we are in the process of implementing a multi-phase process of evidence production. We have involved 8 local authorities and service providers and 3 academic institutions. We want to further dissect all these issues, but we don't want to wait for the final results before turning them into action. In the meantime, we are designing new projects and not just as solution of a specific problem, but as well as data builder to be able to shape the next ones by the knowledge produced. We progressively adapt as we learn more. In conclusion, we have packed this whole approach into a multi-year program. We call it Gaza Resilience Program. We implement projects that leverage the interconnectivity between systems and we contemporarily produce the evidence needed to fine-tune them in order to multiply the public health impact. The health impact assessment is the centerpiece of the next iteration of project. We are building the plane while flying, that's clear. We are just learning how to do it, and we hope it will work. Thank you.